Dennis Locke, Sports and Regenerative Medicine. We're going to talk today about knee pain, specifically anterior cruciate and posterior cruciate tears. We had a 15-year-old teenage soccer player in recently, and an ACL tear, most people hear of, it's a very, very violent injury, but when you combine an ACL with a posterior cruciate tear, much worse. Go over the anatomy a little bit. If we take our kneecap down, and posterior cruciates prevent anterior and posterior translation of the femur from the tibia bone, so it doesn't slide. And it's very important for cutting sports, basketball, soccer, even football. These are very important injuries. When we look at a cross section here, this is depicting the anterior cruciate here, and cruciate is like cross derivative of the word, and here's where the posterior cruciate is, and this is depicting a tear in it. When you have a complete tear, this is the two portions of the cable are disconnected, and it allows translation to occur as the bones slide when you're doing cutting maneuvers. So it's very important for stability. If you have both of these tears, frequently it's such a violent injury that the meniscus, which usually the medial meniscus, but the lateral meniscus can tear as well. The terrible triad is known as the medial collateral, the ACL, and the medial meniscus. This particular soccer player tore both cruciates in the medial meniscus, and he has some of his fibers intact, and he presented to try to see if we could repair him with regenerative medicine as opposed to surgery, because he knows that if he doesn't do well, his soccer career is going to be over. So he's got good muscle tone, good stability. He's several months out of this, and he's a very good candidate to try to repair him. Thank you.